Hi, thanks for joining us. My name is Thomas Duszynski. I'm the Director of Epidemiology Education here at the Richard M. Fairbanks School of Public Health on the IUPUI campus. What is epidemiology and why is this important, especially today with everything that's going on in the world? Well, epidemiology is the study of patterns and trends in a population. And it could be health trends, right? It could be also disease trends. Most people think of us as disease detectives, right? Because we investigate outbreaks of disease, looking at events that have occurred and trying to figure out, well, where did things go wrong? And we thought today that this would be really important and a timely discussion around things that are going on in the world with the pandemic of COVID-19 or the coronavirus disease that's spreading throughout the world. And that's really what pandemic means. Pan is Latin for all, meaning that a global infection is occurring with a novel coronavirus. A novel disease means it's something new, something that emerged to infect the human population. In order to have a pandemic, you have to have three things. The first thing is you need a novel disease, right? Something new, something the human population hasn't seen before or been affected by, which we have. The second thing you need is increased morbidity and mortality, right? And we've seen that, right? So morbidity, sickness, mortality, death. So we've seen that with this coronavirus as well, as more people are being infected, becoming ill, and unfortunately, numbers of them are dying. And then the third and probably the most important criteria in order to actually have a pandemic is you need person-to-person transmission. Now we know that this coronavirus started in Wuhan, China. Probably people became infected when visiting a live market there. Now those first cases, they needed to be exposed to the live market in order to be infected. Since that, the virus has been able to mutate so that we don't need that live market anymore. We could have person-to-person interaction to spread the disease. So in this case, we have all three criteria, and it does meet a pandemic, and we've seen this for the past several months just coming across the globe. And unfortunately, it's here in the U.S. now, and we're having to deal with it.
So Tom, why don't you explain kind of why we expect things to get worse before they get better?
So explaining why we expect things to get worse before they get better. The first thing is that, look, this is a new disease. Nobody has seen this before in the human population, which means that we're all susceptible to it. When looking at the data from around the world, there is not a race, ethnicity that is immune to this at all. Everybody is going to be affected by this. Now, there are certain risk factors that put you at greater risk for a severe outcome, right? If you are older than 60 or 65 years of age, you're at greater risk. Every decade of age that you live puts you at greater risk. So those 60 to 70 are at increased risk. Even more so, 70 to 80, and then 80 plus puts you at the highest risk for a severe outcome. Then there are other factors that put you at risk as well. Diabetes, smoking, cardiovascular disease, hypertension, obesity, all those increase your risk as well. So if you are of older age and have some of those conditions, put you at greatest risk. This is why we're asking people to socially distance themselves from others. So we know that younger people, the youngest, can still get this disease. They can still have severe disease, but generally will recover. Right? We've seen this in populations not only here in the U.S., but globally as well. So that trend still holds true. But what we want to do is keep the younger people away from the older people, right? Separate the distance out between them. When we do that, we're actually protecting the most vulnerable populations.
So Tom, Emily wants to know what sources we can look to for factual information.
So Emily wants to know what sources we can look to for factual information. Emily, I would highly recommend, and there are two sources that I look at every day. The first one is Centers for Disease Control and Prevention. They publish something every day with numbers and updates. The second site that I look at is the World Health Organization, and this gives me a global perspective. You could also look at like the Indiana State Department of Health or your state health department if you're not from Indiana. And even your local health department websites as well will give you the most factual information based on what the current science is saying.
We have a question here from Sarah. She's wondering if someone can be a carrier of the virus without getting sick.
So Sarah wants to know, can someone be a carrier with they themselves not being sick? Right now, evidence has shown, and it's minimal evidence, but there is some evidence, Sarah, that people can have the disease, can be infected, are able to transmit, and may have really, really mild symptoms, and in some cases may not have any symptoms, or at least they perceive not having any symptoms. Most people from this virus, though, will get some sort of symptoms and get sick, and are still able to transmit.
Neil wants to know what are the chances of a COVID-19 mutation in the future?
So Neil's asking about a COVID-19 mutation in the future. Neil, that's a great question and one that's difficult to answer right now. So obviously a mutation occurred because we believe this was an animal virus that merged with a human virus. And this happens throughout history, and there's lots of examples of that occurring throughout history. This is part of evolution. What's coming next is what we don't know. Most of the evidence right now and all my information about these viruses say that once you get this disease, you can't get it again. All right. Now, I know there's been some anecdotal evidence out of China saying that there are people that are reinfected, but that hasn't been studied yet. Everything else kind of points to that this is going to, once you get it, you're not going to get it again. Could it mutate? Absolutely, right? Every human interaction represents an opportunity for mutates. This is an RNA virus, and this is what they do. They mutate, okay? But I would be more concerned about something else emerging in another population than I would be about a mutation occurring in this particular virus.
Tom, both Becca and Hillary want to know if it's safe or responsible to go for walks in parks or outside.
So Becca and Hillary want to know about going outside for like walks in the parks and such. It's safe to go outside. Okay, I don't want you to think that you can't go outside. The trick is to stay away from people when you're outside, right? Keeping that safe social distance at 3 to 6 feet minimum between people is really what we're asking for. So if you want to go for a walk in the park, that's fine, but make sure that you're still staying away from people.
Tom, Shana Patel wants to know that, although we can't know for sure, what's the natural flow or timeline of an infection or a pandemic? When can we expect things to maybe get better?
Yeah, so Shama was asking about when are things going to get better. That's really, really difficult to answer. So what we're doing is we're looking at what is occurring in other countries. So like China, like Italy, Australia, Germany, right, where the infection arrived sooner than it did here in the U.S. So we're looking at their timeline to help us predict what our timeline is going to be. So we think right now this is going to peak in the U.S. sometime around mid-May, and then things will start to improve after that. But that's with social distancing, right? So the efforts that the government is putting in place now to keep people at home will help slow the spread of this, right? But as we slow the spread of it, it means it's going to take longer to work its way through the population. So right now, our best guess is mid-May is going to be the peak, and then things will start to get better after that. If we do nothing, if we allow this virus to spread through the population, the peak's going to arrive much sooner, but we're also going to have more severe outcomes.
Morgan wants to know how it's possible that China has no new cases in a country of billions of people.
So Morgan is curious as to how China doesn't have any new cases when there are billions of people that live, or at least more than 1 billion people that live in China. Morgan, my best guess would be that this has worked its way through the population there. So as I said previously, if you get this virus, evidence points that you can't get it again. So as more and more people in China got infected and then recovered, the virus has no way to keep going in a population anymore. There aren't any more susceptible people to get the disease again. So that's why I'm also guessing that that's why China isn't seeing more cases, and they may even slow down on testing the population for disease as well.
Tom, we have a question here from Aditya asking, how can you distinguish between the normal flu and COVID-19?
Aditya wants to know what's the differences between normal flu and COVID-19. COVID-19 has 3 primary symptoms that we look at, whereas flu has more. So for COVID-19, fever, cough, and shortness of breath. So some difficulty breathing, right? Influenza can have those things as well, but they also have general body aches and pains and sore throats and general just don't feel well kind of symptoms. The only way to tell really the difference is to be tested. Right now we're kind of coming out of flu season. Flu season is ending in the U.S. And more cases of COVID are emerging. So right now, if you have those signs and symptoms in a true pandemic, stay home. Wash your hands. Keep away from people if you can.
Tom, we're getting some questions about from Amira is wondering how long the virus lives on surfaces.
So Amira is wondering how long this lives on surfaces. And some of the data or the science shows us that it can live from hours to days depending on a couple of things. One, the surface itself, right? Is it porous? Like cardboard, I heard it could live up to a day on. But even then, it depends on temperature outdoor, humidity, those kinds of things, right? So how much virus is actually on there, right? All those, there's a lot of variables in that. I've heard a lot of these kinds of questions, is it safe to receive packages and such? And the answer is yes, okay? Even if the virus were on a package, the best thing you could do is take the package, open it up, do what you got to do, and then wash your hands before you touch your face, okay?
Tom, Tyler wants to know how he can best sanitize his house to fight off COVID-19.
So Tyler's curious as to how to best sanitize your house. Tyler, the best way is clean the surfaces. If you have a disinfectant cleaner, just wipe them down. You really will only have to do that occasionally unless someone is actually actively ill with the disease in your house. If that's the case, then you want to isolate that person into like a bedroom, make them comfortable, and then keep the rest of the house kind of clean, knowing that room in particular is where the sick individual is for the duration of illness. And then once they're recovered, clean the room with a disinfectant.
Tom, Heidi wants to know what course of action do you think the government should take next to prevent the spread?
So Heidi's curious as to what the government should do next to prevent spread of disease. I would think a shelter-in-place order is probably going to be the best method at this point. We've seen this work in other countries. I know California, New York, Illinois, Ohio, and some other states have issued these orders as well. And the idea here is that you could still go out for essential travel. Like grocery stores are essential. So grocery stores are not going to shut down, even in China, in South Korea, in some of these other countries, Italy, where you've heard the disease is really, really bad. The grocery stores stayed open because it's essential, all right? And you have to have groceries, all right? What you may want to think about, though, is maybe just send one person to the grocery store instead of the family going to the grocery store, right? If you're essential at work, you could still travel to work. So the shelter in place helps the government kind of keep people, allows for people to stay home, work from home if they can, to minimize the spread of disease.
Tom, Michael wants to know what steps are being taken to increase baseline medical capacity so that our efforts to flatten the curve are meaningful.
So Michael's asking about baseline healthcare capacity in the U.S. So what steps are being taken to do that? I know many hospitals right now are looking at what capacity they have in terms of the number of beds available. Who can they send home early, safely? How many ventilators they have on hand? How many more ventilators can they get? And how much personal protective equipment do they have, like gloves and gowns and masks and things like that? The Strategic National Stockpile has helped Indiana as well as other states in terms of personal protective equipment. So some hospitals are getting more equipment. But as this disease gets, as more people get infected and more severe outcomes start to emerge, hospitals are looking right now at their capacity. The Fairbanks School of Public Health is helping hospitals estimate what is going to happen in the next 12 weeks with each individual hospital. We're trying to provide them some epidemiological information to predict what might be happening so they can better prepare. So we're kind of all working on this together in conjunction with like the State Department of Health, the Hospital Association, School of Public Health. We all recognize that this is going to challenge our system in Indiana and the U.S. and really around the world. So we're all trying to work together and share as much information as we can to help everyone.
Tom, Kelly wants to know if we should now be expecting a COVID-19 season similar to a flu season.
So Kelly's asking a really important question about should we expect a COVID-19 season just like we see a regular flu season. Kelly, that's a really tough question to answer, but I think based on how these viruses have acted in the past is this is going to burn through the population and then it's going to be gone, right? I don't think that we'll see a regular seasonality to this, but that has yet to be determined.
Sarah wants to know how long we will need to continue to practice social distancing after cases peak.
Sarah wants to know how long do we practice social distancing until after cases peak. So Sarah, based on our projections at this point, peak is going to be somewhere around week 7. All right. Now the question is, well, when's week 1? That we're still trying to wrestle with as to when week 1 is or was. But we know about week 7, it's going to peak and then it's going to tail down from there, which means then we have about another 6 to 7 weeks until social distancing won't make that much of a difference anymore.
We're getting a lot of questions from several people asking about is stockpiling food the appropriate reaction?
So a lot of folks are asking about the stockpiling of food as appropriate reaction. You won't need to necessarily stockpile months of food, okay? Because, like I said before, grocery stores are considered essential services, and they will continue. I mean, if you look now, I have not to see any grocery stores close. Yes, they've adjusted their hours to start restocking, but retailers around the country know that they have to stay open, right? The food is going to be there. One thing I think we need to consider is how much do we really need, right? If the grocery stores are going to stay open, which they will, do I need to buy all the hamburger in the grocery store, or can I get by with a couple of pounds for a week or two and then come back again? So try and be kind and fair about and think about how much you really need, knowing that the grocery stores are going to stay open.
Tom, we have a Thomas asking, do we have an estimate for how long the virus has been circulating? Is it possible it arrived in the U.S. before we started noticing?
So Thomas wants to know how long the virus has been around and has it been circulating in the U.S. before we actually started testing. Thomas, my guess is that yes, it's been here longer than what we were testing for. Certainly, China informed the world that they had this new virus back in December, especially located in Wuhan, which is kind of near central China, and then the world's been watching it from there. So I suspect that it was probably here and wasn't tested for because in most people it's a very mild disease, right? It could be mistaken easily for a common cold.
We're going to pause momentarily so I can fix your microphone. We're back live.
So Emmanuel wants to know, Tom, why the virus is harder to treat if it is similar to pneumonia.
So Emmanuel wants to know why this is harder to treat. Unfortunately, Emmanuel, we have no treatment for this virus. Unlike the flu virus, we have antivirals that we can use on the flu. Unfortunately, the antivirals and other treatments that we've tried haven't proved successful in treating this particular virus. I know that lots of scientists are working on trying to see is there a combination of drugs or a drug out there that we currently use for other diseases that will help with this, and none of that's been demonstrated yet scientifically.
Thank you, Tom. Heidi wants to know, as far as the vaccine goes, when do you think a safe and effective vaccine could be produced?
Heidi's asking about a vaccine for this particular virus. Heidi, the good news is that with genetic sequencing, we have capabilities today. We get an understanding of how to construct a vaccine fairly quickly. The problem is we have to test this in a population to make sure, one, that it's effective, and two, that it's safe for the human population. And that could take anywhere from a year to 18 months to do correctly. And we have to be correct, right? We can't make a mistake with that. So the vaccine itself could be produced relatively quickly. It's the testing in the human population that takes time and is absolutely necessary for safety.
Tina wants to know why testing is not more widespread in the U.S.
So Tina's asking about why isn't testing more widespread in the U.S. Tina, initially we had to wait for assays. These are test kits essentially from the CDC, right? Since we'd never seen this virus before, there was no known test to detect it. So we had to build a test first of all. The second thing that had to happen is that test had to be pushed out to the state labs. The state labs all use different equipment to test these things on. Some of it's similar from state to state, but a lot of them have different machines really to test on. So then those machines had to be calibrated using these test kits. And then finally the testing supplies like the swabs and the test tubes and such that they transported in have to be pushed out to doctors' offices to allow them to start testing the human population. In a true pandemic, though, we don't need to test everybody. If you have signs and symptoms, you can just assume you have a disease, and you should stay home to protect others and yourself.
Austin wants to know, are there any recommendations you would make for healthcare workers who might soon struggle to obtain proper PPE?
So Austin is asking about healthcare workers and obtaining PPE. I know hospitals right now and doctors' offices are stockpiling and trying to get as much personal protective equipment as they can. That's another reason why I know some states have stopped testing the general public, simply because every time I go out to test somebody, I have to put on personal protective equipment, masks and gloves and gowns. For most mild cases, I don't need to test those people, and I don't need to use the mask, gloves, and gowns then, right? We will continue to test people with most severe disease, those that are going to be hospitalized, just so that we know what we're dealing with.
Tom, Becca wants to ask your thoughts on the United States' response to this disease.
So Becca is asking me about the U.S. response to this disease. Becca, I'm really glad to see the states are taking their actions necessary to help prevent the spread of disease. I look to California, I look to New York, and some of the other states that have been really aggressive at doing this. You have to remember, Becca, that public health is a state issue, right? The states are responsible for doing public health. And then the federal government is a resource for the states to do that. And certainly the federal government has a lot of resources like CDC and the NIH. But the states are ultimately responsible for protecting their own citizens. So many states are doing very aggressive actions to protect the population, like sheltering in place, and in trying to reassure the public that things like grocery stores are going to stay open, essential work will continue, and that we're going to get through this.
Tom, this is a question from Rachel. She wants to know, does social distancing mean staying away from my parents and my family if I don't live with them?
So Rachel asks, does social distancing mean staying away from mom and dad if I don't live with them? And the answer is yes. If you're not living currently in the same household, what we don't want you to do is go to those households either for a visit or to stay, unless that's your only option. I know that a lot of the universities in Indiana, as well as across the country, are starting to, if they haven't already, close student housing. In that case, if you have no place else to go, if you didn't have your own apartment, then going back home is going to be your best option. But if you already have an apartment, don't go home. Social distance in place.
Tom, Liz wants to know, are there companies within the state of Indiana that are currently manufacturing PPEs?
So are there companies in the state of Indiana that manufacture personal protective equipment? I don't have a good answer for that. I don't know if some of these companies are. I know that there have been companies donating personal protective equipment, not only in Indiana, but across the U.S. I even saw that some of these doctor shows on TV have donated their personal protective equipment to real-life hospitals and shut down production on some of these medical shows that TV uses. And I've lost my microphone again, so I'm going to try and put this back on.
Sure.
A couple more questions here. Another one from Becca here. She's asking about Governor Holcomb going live. What announcement do you think he's going to make?
So we've heard that Governor Holcomb is going to have a press conference today at noon. I don't really want to speculate what he is going to say or what he might do. Certainly I know that he has been in contact with the State Department of Health, Family and Social Services Administration, our own school, to kind of gather as much information as he can to make a good decision to protect the public's health.
We're getting some questions from students wondering if they think that the social distancing will bleed into the fall months, the fall semester.
So students are asking, or many people are asking about, will social distancing bleed into the fall semester? I don't believe so, based on what we've seen come out of other countries, that the virus moves fairly quickly through the population. And by quickly, I mean 3.5, 4 months at most. I don't believe that by fall that we'll still have to be in this situation.
All right, Tom, a couple more here. Morgan wants to know, why do you think the virus has hit states like Washington, California, and New York harder?
So Morgan's asking about Washington, California, New York, and the impact of this virus in those states. Morgan, I don't know if they've been hit any harder. I know they've been a little bit more aggressive in their testing capabilities and testing the public. And when you test more people, you're going to find more disease. Also, those are ports of entry for the U.S., right? So flights coming in and out of other countries land generally on the coasts. And as people move, so did the virus itself. So I think what we're seeing in California, Washington, New York is the first wave of what's coming across or going to sweep across the rest of the U.S. is that we're all eventually going to be in kind of those situations unless we take very aggressive actions to keep people away from one another or social distancing, as I've said.
Tom, Lisa wants to know, do you think the current severe restrictions are working?
So Lisa's asking about if the current severe restrictions are working. I think they are, Lisa. I think that when we ran our predictive models, we could definitely see what you've heard a lot about, this flattening of what we call the epidemic curve, right? This idea that cases go up and they come down. If we put these social distancing restrictions in, if we educate about good hand washing, not touching your face, isolating people that are ill, we could actually lower that curve. Now, when we lower it, though, it pushes that exposure period out a little bit longer. But it also means we're going to save some lives by doing that.
Madison wants to know the nature of the virus. Is it airborne?
So Madison's asking about the nature of the virus and whether or not it's airborne. It's actually a respiratory virus, very much like the flu or the common cold, right? So coughing, sneezing, blowing your nose, even talking with somebody that's infected can actually expose you, and you have to breathe it in, right? It gets into your lungs that way and causes disease in your lungs, very much like the flu. That's why having that 3 to 6 foot separation between you and another individual helps reduce your ability to kind of breathe that in and be infected.
Tom, Tyler wants to know why face masks don't work as well as a protective measure.
So why don't face masks work as well as a protective measure? I think there was a question from Tyler. So Tyler, that's a really good question because you saw a lot of people wearing face masks and a run on face masks. The only face mask that really worked well with this particular virus is something called an N95, which had a little respirator on it, right? But it has to be really tight fitting around your nose and your mouth up against your skin so nothing else can get in. General surgical masks aren't tight fitting like that, right? They're open on the sides and things can get in. Usually people that wear those kinds of masks are ones that are sick, right? Where if they're coughing, we want them to cough right into a mask or talk through a mask to help kind of minimize the amount of virus that's coming out. I'll tell you, I've worn N95 masks. They are not comfortable for long periods of time. 15, 20 minutes, they're pretty miserable. Wearing those types of masks. But in general, the public doesn't need them if you're doing social distancing.
Tom, Tina wants to know, what about the structure of this virus makes transmission faster than the flu?
Tina's asking about transmission of this virus being faster than the flu. I don't know that it really is faster than the flu. Actually, the incubation period is 2 to 14 days for this virus. So that the incubation period means from the time of exposure until signs and symptoms develops can be anywhere from 2 to 14 days in length. Influenza has an incubation period of 1 to 4 days. Okay, so it's a much shorter incubation period. I think what makes this virus unique is the fact that it is new. Nobody has any immunity to it, right? We don't have a vaccine to protect you against this like we do the flu. So if you're exposed, you're considered susceptible. That meaning that you can get the disease. I don't think it's moving any faster than the flu.
Tom, Neil wants to know what's the best way to protect ourselves and our families when we're forced to go out to places like the grocery store?
Neil wants to know how can we best protect ourselves and our families when we have to go out, right? Neil, that's a really good question. So I think the best way to think about this is minimize your contact with other individuals and keep a safe distance. If you have to go to the grocery store, don't take the whole family. Just send one person, right? Make a good list, send a person. That way you're minimizing that exposure. There are fewer hands that need to be washed, right, at that point. If somebody is sick in the house, make sure that you can maybe isolate them in their own bedroom. We'll make sure they're safe. Those are probably some of the best measures that we have. Hand washing, not touching your face, right? Those kinds of things. We know that the average human or adult touches their face approximately 20 times an hour. So that's almost 300 times a day that you're touching your face. If you could just minimize that and wash these frequently, will help minimize the spread of disease.
All right, Tom, we're going to do 2 more before we wrap up. One's a question from Sydney asking, what do you suggest for people whose companies won't close down, for those who work in retail and have to have contact with customers?
So Sydney's asking about what about companies that won't close, such as in retail that won't have, that, say that again, that don't
have contact with customers.
Contact with customers. Sydney, there are some businesses that are absolutely essential, right? Things like grocery stores are absolutely essential. We're going to have to do that. I think the best things that they can do, some of them are already doing this, is minimize their hours, right? So I know that like Kroger and Walmart, which used to stay open 24 hours, they're now closing to restock and to clean surfaces. The other thing you could do is wash these frequently. Maintain a safe distance from customers as well will definitely help.
And our final question is from Tyler. He wants to know if we should be expecting pandemics like this more often.
So Tyler's, and you said this is my last question, so Tyler's question is, should we expect pandemics like this more often? Tyler, more than 40 new diseases have emerged in the human population since the 1970s. These are products of evolution, right? We've had 3 pandemics in the 1900s that went through the earth. We had another influenza pandemic in 2008 and 9. We had SARS in 2003. MERS was on the verge of becoming a pandemic, hasn't yet. Viruses mutate. That's what they do, right? And occasionally humans get in the way of that mutation. And I think we have to always be prepared for a pandemic. As evolution occurs and viruses adapting to their environment, we should expect pandemics. We shouldn't be caught off guard by these things. We should just expect them. Are there going to be more? I'm not sure what more really means, right? It's just, like I said, evolution.
Feel free to sign off, Tom.
Great. Unfortunately, I can't stay any longer, but I certainly appreciate all your questions. I think they're really well thought out and ask really important things. I guess my last advice to you is keep social distancing. It does work. It really does, right? If you're home, please, or if you're sick, please stay home. Self-isolate yourself. Wash your hands, right? Especially touching surfaces. If you're going out to get groceries and stuff, do that. Don't touch your face while you're doing it. And then come home and wash your hands, all right? Be kind to one another and take care of each other. Thanks.